Good evening. I am Dawn McSween, and my topic is the environmental causes of cardiovascular disease. Today, I will be presenting 8 of these causes, but before we begin, I would like to start off with some definitions. Environmental. This refers to the combination of social, cultural, and external or extrinsic conditions that affect the growth and development of an individual. As you can see, these can include the workplace, pollutants, community, food, and water. Cardiovascular. This is anything pertaining to the heart and blood vessels. A disease is an abnormal condition that impairs the normal physiological functioning. Cardiovascular disease, then, is the abnormal functioning of the heart and blood vessels. This can lead to an increased risk for heart attack, heart failure, sudden death, stroke, arrhythmia, poor quality of life, and decreased life expectancy. Some statistics. 1 in 3 adults in the United States have some form of cardiovascular disease. In 2006, 81 million Americans had one or more forms of cardiovascular disease. Cardiovascular disease is the #1 killer of men and women in the United States. And finally, cardiovascular disease is the #1 cause of death in developed countries worldwide. Probably the most universal environmental cause of cardiovascular disease is diet. In the US, because of convenience and for economical reasons, fast foods are the most accessible foods to most Americans. These fast foods, however, are low in nutritional value, and when food is not nutritious, this impedes our health and makes us more susceptible to diseases. Fast foods are also high in saturated fats, which can lead to bad cholesterol buildup. Now, the body does need cholesterol to function efficiently. The liver produces about 80% of the required cholesterol, and we are supposed to get the other 20% from our diet. However, because of the high content of saturated fats in our diet, low density lipoprotein or bad cholesterol LDL often outnumbers high density lipoprotein or the good cholesterol HDL. This causes plaque to build up in our arterial walls, leading to heart attack and stroke. 80% of heart attack patients have high cholesterol. 2. Obesity. Someone is considered obese when their body mass index is greater than 30. To get someone's body mass index, we divide their weight in kilograms by their height in meters squared. Obesity tends to elevate LDL or bad cholesterol and lower HDL, good cholesterol. It also decreases metabolism and puts us at risk factors for hypertension and diabetes. 3. Diabetes coexists and is a comorbid condition such as hypertension and high cholesterol. It causes poor blood circulation, which leads to complications like PAD, peripheral artery disease. This can lead to blood clots, which in turn can lead to stroke. Hypertension and salt. Hypertension places severe stress on the heart and damages the arterial walls. When these walls heal because of the scar tissue, This can lead to plaque buildup. Fast foods and processed foods are high in sodium. Because of this, our blood tends to absorb more water, thereby increasing its volume. This gives the heart more work, and this leads to hypertension. Inactivity. Activity or exercise makes the heart work more efficiently. It helps to burn calories, controls cholesterol, decreases blood pressure, strengthens heart muscles, and makes the arteries more flexible. Life in America has become very inactive. Many jobs are sedentary. There has been an increase in the watching of TV and video games, and many schools have eliminated physical education from the curriculum. This leads to obesity, and as we have discussed earlier, these can lead to many heart-associated complications. Pollutants, cigarette smoke. In 2010, 69,000 people died from heart disease related to smoke inhalation, and this included secondhand smoke. Cigarette smoke increases heart rate, tightens major arteries, causes irregular heartbeats, and leads to blood clots. Also, the ingredients in cigarettes, tartar and carbon monoxide, causes plaque to build up, and this affects the blood clotting mechanism. Hygiene and infection. Poor hygiene can often be overlooked as an environmental cause of cardiovascular disease. However, it assists in spreading viral and bacterial infections. And for individuals who already have an underlying heart condition, this increases their risk to more serious conditions. Stress. Stress can be physical, emotional, or psychological. Too much stress is not healthy. Stress increases adrenaline, the heart rate increases, the blood pressure increases, and that puts pressure on the heart. As we can see, there is a cyclical effect to cardiovascular disease. Diet affects obesity, that affects inactivity, hypertension, cholesterol, and stress. And we can begin anywhere on the cycle and it will still have an effect on something else. If our cholesterol is high, chances are we are inactive and obese because our diet is not proper. Despite these adverse things, we can combat cardiovascular disease by making simple lifestyle changes. It is never too late to begin. Eat a heart-healthy diet which is rich in fruits, vegetables, fish, and decrease meat and dairy consumption. Exercise at least 3 times a week for 20 minutes. Monitor your BMI. An ideal weight is between a BMI of 18.5 and 24.9. Avoid cigarette smoke, and this includes secondhand smoke exposure. Monitor salt intake and decrease stressful situations as far as possible. If we make these simple lifestyle changes, we can positively affect the environmental causes of cardiovascular disease and significantly decrease the number of deaths caused thereby. Thank you.